Kia ora, my name's Catherine Metcalf. I work in the Mental Health and Alcohol and Drug Service. My role is dual diagnosis practitioner, so I work with both people who have mental health and a coexisting substance use issue, do one-to-one counselling, group work.
Kia ora, my name's Richard Dick. I'm a consumer networker. I work for Arataki Ministries and I've been in that role for just over 3 years.
Kia ora, I'm Alex and I'm an alcohol and drug clinician and counsellor. It's very similar to the role that Catherine has, less specific to do with dual diagnosis and mental health, but more focused on the alcohol and drug side of things. I run groups as well and do individual counselling. From our point of view, at DHB, the Mental Health and Addictions team, there was a lack of peer support in the community, and we really wanted to support any kind of grassroots movements that was going to happen. So we were really keen to support anyone that could do that for us, or with us, for the community, really.
Well, I think when people are making major changes in their life, regardless of whether it's mental health or addictions, but specifically those areas, clinical services are involved in their lives for brief periods of time, for a short period of time. But they live in the community, they've got families, and so to be able to sustain those changes, you need people around you who are going to support you, really. And in Whangarei in particular, there's we've got 12-step stuff meetings, but not everyone fits into that, and so we wanted something in addition to that, and Richard and his team stepped up and we really wanted to support that because it helps us in our work. You know you've got people there supporting the people you've been working with making the changes.
I guess, okay. A safe place, somewhere to go and speak openly and honestly that they might not find anywhere else. So create an environment for people to be able to do that, I guess, is the most prominent one that people find. And just that collective support that people can give each other. And I guess stepping outside of what people are used to, their normal circle of friends that might not be conducive to their recovery, and so finding other friendships that are more conducive, I guess, towards well-being and recovery. Our contract is a Northland-wide service, so our core business is networking, and we also try and have as much presence out in the other districts as we possibly can through that core business of networking. And so another group has been set up in Kaitaia, very similar to what we have here, and we're hoping to transfer that mentoring process to people so you get that organic process going on and happening in Kaitaia. So the group's already happening. With the facilitators from here are doing that, so we're searching up there for people that will end up facilitating that group and hopefully have the same mentoring process that we have down here in Kaitaia.
I think a key part of the process of this, what we're doing, and I think it's a word that I'm borrowing from you, Richard, but I think it really applies, is sustainability, and really trying to build that into what we're doing so that this goes beyond any one of us. So if any one of us leaves or something happens to us or whatever, that the project and what we're trying to do carries on. Hopefully throughout Northland would be really great, but initially just for Whangarei. So that would be really cool.
And I guess one of the benefits we've seen in the Kaitaia group is that there are actually a couple of people that travel from Kaikoai to Kaitaia to attend the group, because there is nothing that I know of in regard to peer support, addiction peer support in Kaikoai. So,
The mentoring process has enhanced my clinical practice hugely, and it's kept me grounded in the values I have around my clinical practice and what's important. So I hope really that what the clinical knowledge we share is of value to the peers, because what they share with us has had a huge impact on my clinical work and actually our group, really. Feedback from them about what's helpful in group and what's not helpful, and yeah.
I think taking the idea that you were talking about before, that the group's quite a lot about non-judgment, non-labelling, acceptance and stuff like that. I think as clinicians, you can kind of get caught up in trying to make the person well so much that you kind of get lost in the technical jargon and the language and the best practice that you forget about the human. And I think that's what this process reminds me, or keeps me thinking about, because I think that's essential to recovery, to changing your drug and alcohol use for those people struggling in our community.
I guess for me, it might be going out on a bit of a limb, is if you have a passion and if you really believe in it, do your homework, get the evidence, and keep plugging away till you get what you want, really. Yeah.
I think in terms of addiction treatment is going to the source of the problem and finding out what's working for those people. And I guess to find that out, you need to go and talk to the people about it. So it's a good place to start that discussion and find out, what is helpful for people. What are the labels that turn them off, turn them on? What's helpful for them? What enhances their mana? What empowers people? Things of that nature.
I guess I just carry on with that and listening to the patient, listening to their needs and desires and wants, and trying to adapt our service to accommodate for that. And I think, like Catherine said, I think being a champion of that passion, of taking that forward and trying to make a change in your particular area. Yeah.
I think, like with the recent groups that we've done, because we've altered them a little bit, but the evidence for me is when you get probably what would be described as some fairly hardcore people, and you see the changes they make, and that's been about an equality of relationship, really, that they've participated in that change as much as we have. So yeah, it makes a huge difference.
For me, the clinical services and the community services really complement one another. What the clinical services are unable to or can't provide, I think the peer support community services can really fill the gap in and do that. Whereas equally, there's a kind of limitation to that as well. There's a clinical expertise that myself and Catherine and our team have that we can also offer. So I think that both areas, both teams, services, whatever you want to call them, can fill in the gaps that the others can't. And I think it's really amazing that we can work together so closely to ensure that gap is filled for everyone in the community that needs it, really.